Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Today we will discuss about the writing, and I promise you, if you will follow this video, you will learn almost 90% about OET writing, whether you are starting your first day or even if you are taking your exam tomorrow. This is the writing that you should follow to pass OET exam in the easiest of the ways. The pattern, the things I would try to explain each and everything. So please be here and be attentive while watching this video, whether you are YouTube follower or you are our students. This I will try to make it very special. Of course, it would be little boring because when you do something very special, it takes time and effort that sometimes leads to boredom. But again, I promise I will try to make it as quick as possible. And please subscribe our channel if you have not. Our number is 76967342256 for the best OET coaching. First of all, in the writing, you have to write the name of the person to whom you are writing. So suppose if you are writing to a doctor, so write Dr. James Anderson. Then you write the designation like ophthalmologist or whatever you want to say, whatever is given to whom you are writing the letter. Then you write about the hospital. Suppose if it says Royal Melbourne Hospital, H capital. So I'm also putting the words capital, M capital, H capital, R capital, O capital, doctor. There's no commas, nothing. Then you mention the today's date. Suppose today date is 28. What's the date today? It's 15th of November. So I will write it today's date, 15th November. N should be capital. No small mistakes of punctuations. Why to lose marks? It's very important. Please be here and learn. So change it to N capital. 2023. And today's date means according to the letter. If the last date is given as 2018, so take it this date. So 15 November, whatever the date is given as the last date would be your today's date. Then you write regarding. Regarding means to whom you are regarding. Regarding Mrs. Maria Jones. I'm just taking just like that. Mrs. Maria Jones, M capital. Jones, and then you mention her age, 25 or 26 or 85, whatever is given. This is the pattern. Then you say, Dear Dr. Anderson, second name of the doctor. That is how you start the OET. Okay, check out for your spelling mistakes, but I'm not checking it right now. You will do it yourself because I want to tell you what is the pattern. This is what you do, comma only at this place, comma here, and no commas else on after November. These are the commas, only 3 commas. Now, first paragraph is always reserved for purpose. Now the letter can be huge, it can be very massive. You will sometimes the problem is that you guys want to know whether it is a referral letter, it is a discharge letter, it is a discharge back. You need not know about this thing. Just find out the purpose. Suppose if you are writing to a Dr. James Anderson, ophthalmologist, obviously we all know being medical professionals, and that is why I always say OET cannot be taught by a person who is not a medical professional, because the person who is not a medical professional will not know who is an oncologist, who is an ophthalmologist, who is a GP, who is social worker, community support worker. What is the difference between community health nurse and community support worker? That is why OET can be taught only by the medical professionals. That is why I emphasize on this thing. Sorry, coming back to the main point. So ophthalmologist, so we can all understand today we are talking about eyes. So eye should be the problem. So please think according to ophthalmologist now. Suppose if he's not an ophthalmologist, he's an orthopedician. Then think about bones, fractures. Think about any problem with the cartilages, muscles, hairline fractures, compound fractures. So then this becomes the main data. Suppose if you're writing to the physiotherapist, then concern becomes the motion, the mobility, the ambulation. So you have to find the purpose according to whom you are writing the letter. So that is what you should know. Then you would be able to find the purpose. That to whom you are writing the letter is the most important. Suppose now this is again a very typical thing, occupational therapist. This we do not know in India. Occupational therapist. So these people are the ones who help you at your workplace to adapt to your workplace. Again, very rare that this kind of a person will come, but we will talk it about according to the letters. But today we are talking about the pattern. So anybody starting from the scratch to the most advanced stage, please listen to it very carefully. Again, subscribe our channel if you have not. Coming back to the point. So you have written all these things. Now I'm writing according to suppose oncologist. Oncologist means a cancer specialist who can treat the cancer. So again, then the letter would be something like this. Letter is being written regarding Mr. X, but I have used Mrs. So my patient is Mrs. I will say Mrs. Maria, Mrs. Jones, sorry. The second name you will write. If the patient is above 18 years, then you will always write second name. If patient is less than, suppose if she is 17, then I will use the name Miss Maria. MISS, I will change it to Miss Maria. Then I have to write the first name if less than 18. This is also one of the rules you must know. Okay. This letter is who suppose today she has been diagnosed with cancer. That is why you are referring her to the oncologist. So who has been diagnosed. So this is the tense we use. It is known as present perfect passive voice. Present perfect passive voice. What I mean by present perfect is that she has been diagnosed means it has been done. It has already happened, that you have already diagnosed the patient. So you say present perfect, the things that have been done. Passive means that has been done by the doctor or by you. Has been means it's a passive voice. Has been diagnosed by you. Has been diagnosed by the doctor. So when there is has been third form, it is a present perfect passive voice. So we are talking about the if the patient is by chance suspected, then if there is question mark given, that means the patient is suspected. So you just replace the word that this letter is being written regarding Miss Maria, who has been suspected with whatever the cancer that has been given, benign cancer. Full stop. Therefore, she is being referred. Forgive me for the spelling mistake. Therefore, commas also note. After therefore, there should be a comma. So notice all these things. Notice all the connectors like who, comma, who. So comma comes before the connectors. Notice all these small things. Please do not get bored with the lecture. It will be hardly of 15 minutes, but you will learn everything about writing. Therefore, she is being referred under your expertise on urgent basis. Now, for what? For whenever patient is suspected and you are sending it to a specialist, obviously you want definitive diagnosis. So therefore, patient is being referred under your expertise is very important word when you are writing to the specialist on urgent basis for definitive diagnosis and further management. So this becomes your first paragraph. If the patient is already diagnosed, if question mark is not given, if the patient is already diagnosed, then you say for under your expertise on urgent basis for management. For her management. Yeah, for bus, or otherwise you don't even write for it, it is not required. But when you have to do definitive diagnosis and this, then you have to write. Okay. So this becomes the first easy paragraph. So make it only 3 lines maximum. 3 lines maximum. And overall, it is only 2 lines. When I'm talking about 2 lines, that means I'm counting the full stop. 1 line, 2 line. That's it. So you want only 2 to 3 lines in the first paragraph. Second paragraph, you will talk about the social history or medical history. So if the patient is having cancer, suppose she is 45, then I will change the name here, Mrs. Jones. If she is not married or we don't know whether she is married or not, then I would write MS. So now becomes this letter is being written regarding MS Jones, who has been diagnosed with benign cancer. Therefore, she is being referred under your expertise on urgent basis. So I'm telling the oncologist that we need your help. Now, obviously, when it comes to cancer, smoking, drinking, all becomes important. Mrs. Jones, MS Jones, sorry, MS Jones, J capital, is a smoker and smokes around 20 cigarettes a day. 20 cigarettes day means one pack a day. Writing numerical in between is not a problem, but do not start with the numerical. So if you want to start, like suppose the next paragraph, sometimes you want to start 1 day ago. 1 day ago means anyhow yesterday, 1 year ago, suppose 1 year ago. So when you are starting a paragraph with one, never write it like this. Always write the complete word. In between, you can use numericals. So that is why I told you I will tell you everything. So write all, is a smoker, smokes around this. Also, she drinks, but OET says don't use also. Don't use also in the start after full stop. So you say she is, she drinks as well. So now this also word comes under well. She drinks as well. And her intake is about 2 or 3 or 2 packs a day or whatever is given. Whatever is given, you do not create your own data in OET. Everything is given. You just frame this wonderful grammar. She, first form, she drinks. S is very important with singular. Mr. Miss Jones is a smoker and smokes. This S is very important. Third person singular. He, she, it comes with S. That is what is very important. Very important to get marks. Then suppose if social history over, you want to write about medical history. Her family history reveals, simple, no, nothing to make it complex. Reveals that her mother was also diagnosed with cancer when she was 50. Suppose that history is given, so write it in the easiest of the ways. Her family history reveals. Her family history reveals. Sorry, reveals. Again, it is singular. He, she, it. So her family history means it. It reveals. Her family S is very important. Yeah, these are marks. These are marks. Grammar. So you talk about social history and medical history. Be careful about grammar. Suppose if she does not smoke now, then you have to say Mrs. John used to be a smoker. She used to be a smoker. This is a very important tense when a patient quits smoking in between. So Mrs. Jones used to be a smoker and smoked around one pack a day. So you cannot formalize that social history and medical history would always be in the present. It is according to what your mind thinks in regional language. If she used to be a smoker, write used to be a. If she is a smoker, so don't define that social history would always be in the past, would always be in the present. Don't define it. Her family history, that her mother was diagnosed, again was also diagnosed. So this is also passive voice. When the passive voice is in the present, has been diagnosed. When it is in the past, was plus third form. That is the only grammar you need to know about OET. S is very important when you are talking about present tense, and in passive voices has been diagnosed, and in the past passive voice was diagnosed. Only two grammar: was plus third form, has been third form. Present, past. These are the two grammar things that you have to remember. That's it. Suppose she underwent surgery in the past. She underwent surgery in the past for this and this thing. So if you will notice clearly, I don't need any connector. She used to be a smoker and is a simple connector. She drinks as well. So I replace the also word as well with as well. She drinks as well and her intake is about this. Her family history reveals that is a connector. Her mother was diagnosed. She underwent surgery. I do not need any connector. So don't push yourself to use connector. Sometimes people deliberately put it like also, then they further, then she moreover, all these things are not accepted in our medical terminology. That is why, again, you need a medical professional to teach you OET. You don't need all these stupid connectors when it comes to OET, and these are not connectors. Connectors, anyhow, are the words who help you to connect the lines. Like this is a connector. When you use a full stop, then it cannot be a connector. Connector means to connect two lines and full stop should not be in between. So these are connectors. But in OET, you do not use the connectors compulsively. You use it according to when it is required. Third paragraph is about during hospitalization. But in this paragraph, patient is going to oncologist. So obviously, he was not hospitalized because if we were general sense, common sense, if we were a nurse in a hospital, then we would have also got the oncologist. So he must have come to our clinic, GP clinic. So he must have paid visits. So you talk about visits. So according to what is required. So you say on 28th November or on, oh, sorry, 15th November I'm using. So on, suppose 3 months ago. You can also write it 3 months ago, or you can put the date if date is given. So suppose if it is given 15th November or 10th August 2000, 2018. So if I say November, October, September, August, so it's like 3 months. So either you can write almost 3 months ago, better is to write on 10th August. Now this is how you use the third paragraph. Now go according to the dates. On 10th August, the patient visited for the first time. This is normal past indefinite with second form. And this is active. That means patient visited himself. So the only difference between this past indefinite and this past indefinite, both are past indefinite. One is active. Patient is coming by himself. Diagnosis is done by us, by the hospital. So whenever anything is passive, was plus third form, anything is active, then it is simple second form. That's it about the tenses. Now it will become simple. On 10th August, the patient visited for the first time. Simple. And he was having A, B, and C symptoms, whatever the name of symptoms. Suppose if many symptoms are given, then you say along with that, he also complained of, so symptoms can be complaint as well. He complained of this and this thing, D, E, and F. If 6 symptoms are given, then you break it into 2 sentences and use this thing after full stop along with that. Now, after symptoms, there is always examination. On examination, now examination is done by you. So now everything will be in the passive voice. Until now, it was active. The patient visited, he complained of, second form. Now everything will be passive. On examination, he was found with whatever signs. He was found with this and this and this. Further, he had rest of the signs if there are too many signs. Otherwise, one line only. This is the pattern, easiest pattern. Then symptoms are there, signs are there. Now would be the investigation or would be the diagnosis. So symptoms, signs. The patient visited with these symptoms. On examination, he was found with this thing. Therefore, or thus, he was diagnosed with whatever diagnosis you did. You write that diagnosis. Then you use the connector for which paracetamol or whatever treatment was given, medication was prescribed. So suppose if the patient visited for the first time with the pain, thus he was diagnosed with pain for which connector, these are the connectors, commas, for which medication was prescribed. All done. Second paragraph is all done. Now, if it's better if you say rather than thus, you can use at that time. This is where it becomes more medical. So you do not write thus, it's better to write at that time. At that time he was diagnosed. This is better. This is OET. Why to use therefore again and again? So at that time he was diagnosed with this thing. So that means we are talking about 10th August that he came with these symptoms. He had those signs. At that time he was diagnosed with this thing for which this medication was prescribed. Everything in the past. Simple. Along with that is also past tense. Along with that means at that time. So these are the things you should remember by heart. and 90% you will write the same thing in the final exam as well. Almost same. Now you copy paste this paragraph. Suppose if the patient came after a month. So you same after a month, one space, one line space in between. After a month, the patient visited again. So if by chance you think that this is repeating, so you change the word with presented. Presented again. Now for the first time would disappear. And he, rather than having, you can say he was suffering from. So now the whole sentence becomes after a month, the patient presented again and he was suffering from these symptoms. Along with that can be replaced by in addition. In addition, he also complained of this thing. On examination can be replaced by after assessment. Just same grammar. Grammar will remain the same. So grammar, that is why in OET there is no grammar. After assessment, he was found with this thing. At that time, miss it, just write, she was diagnosed with this thing. Sorry, I'm writing he, but it was for she. So I should change the patient visited. So I would write she. So these small mistakes can also happen in the final exam. Always check your gender in this thing. She was diagnosed with, and she was suffering from this. In addition, she also complained of this thing. After assessment, she was found with this thing. Now you don't have to use connector again and again. You simply can say, so she was diagnosed with. If you want to change this line, suppose if you write she was found with those signs, thus now a change of sentence, diagnosis of disease, the name of the disease was made. So this is where you can change the tense. So where you were saying she was diagnosed with, you can say diagnosis of this was made. Now this is change of sentence. Suppose diagnosis of cancer was made. So that is how you can change your sentence. That she was having these symptoms, this after assessment she was found, thus diagnosis of cancer was made, for which she was referred to a, so she was prescribed this, whatever medication you given. So tense almost remains the same, it's just about maneuvering it. Again, the last paragraph, today visit. Again, copy paste, today. Copy paste today. Now everything is come in the present. The patient has presented again. Active will become has presented again. And she is suffering from this and this thing. This line will not be required. After assessment word can be changed with on being assessed. I'm telling you simple way. On being, last paragraph we have reached. On being assessed, was found will be replaced by, like in the first paragraph, now it is present tense, was will become has been. This is the only grammar you should know. Therefore, diagnosis of cancer has been replaced by has been made, for which she has been prescribed the name of the medication. She has been prescribed this medication and is being referred under your expertise. All over. This is OET. Matter of just 15 minutes. And is being referred under your expertise. If you don't want to repeat this sentence, she has been prescribed and your expertise is highly required. So you change your sentence again. That's it. The best way. Purpose, social history, medical history, 2 paragraphs. You can also make it 1 paragraph. Does not make a difference. No problem. Nothing to worry. Today visit, this paragraph. You can make 4 paragraph or 5 paragraph. Does not worry. Does not make a difference. Obviously, it looks more clean when you make 5 paragraphs. No problem at all. And this word count is already 200. This is how small OET letter is. That is why again I say OET is the easiest thing. That's it. Over. She has been prescribed this. If you want to put a So if you want to put a full stop also, your expertise in this case is highly required. So you tell the specialist that we need you. Then you say this and the word count is only of these things. This is the word count. Don't count any other word apart from this. This is your word count in the final exam. That should be around 200. That's it. Now, last thing, ending of the letter easily. Should you require further information, feel free to contact yours sincerely. S should be small. So what time I'm doing small, please make it small. Yours sincerely. Sorry, yours sincerely. Spelling of sincerely, something wrong with me. Yeah, yours sincerely. Space, registered nurse or registered doctor. That's your OET. Small, easy, does not take even like 15-20 minutes. You will get 45 minutes. Ample time. First paragraph, make it as crisp, as brief as possible, but do clear the purpose. Second paragraph, write about the relevant social history and medical history. Her family history reveals or her medical history reveals. Suppose if by chance family word is not there, so simply her medical history reveals this. Dates, according to dates, go with the flow. If you want to, if you have got 4 or 5 visits, you want to mix up visits. So you can say on subsequent visits. So you can mix up 3-4 visits if you want. According to the task, how much it is important to mix, how much data is given, that you have to behave like a good nurse who knows how to write. That's it. Nothing else to say. Again, grammar has been plus third form. Then it goes in the past, was plus third form, was plus third form. Today visit again, has been third form, has been prescribed. So this is the difference between the present. The only thing you should remember by heart in the grammar is was plus third form is passive past and has been third form is passive present. That's the only thing you need to learn. Was plus third form is passive past and has been is present passive. That's the only grammar. Test, obviously, you can say the patient has presented again or the patient presented. In the past, it is presented when it is active, and patient has presented. That means he has come by himself. Has plus third form. Please copy paste this thing 2-3 times. Copy paste it, no problem. Copy paste it, no problem. And dekhna, when you will write the 4th time, you will be a champion of OET writing. Copy paste it. Don't worry about it. This is Dr. Bhupesh from Dr. BKM Institutes. Subscribe our channel, assuring you for the best OET coaching. Our contact number is 7696734256. Thank you very much. We'll see you the next time. Have a great time. Thank you.